Okay, everyone. Thank you for joining us today at our REFSA Discuss webinar series. Today, we'll be discussing a very pertinent topic on COVID-19 and the crisis of preparedness and the whole of society response. So just bear with me for a minute because I will like to make this session live on Facebook so that there can be more people joining us. Okay, once again, I would like to welcome everybody to our REFSA Discuss webinar series. Today, our topic is COVID-19, crisis preparedness and the whole of society response. Today, we have with us three very distinguished speakers. First, Prof. Adiba Kamaruzaman, the Dean of Faculty of Medicine at University Malaya. And secondly, we have Ms. Lilian Fan, the International Director and Co-founder of Guitanyo Foundation. And last but not least, we have Lieutenant General Datuk Pahlawan Dr. Muhammad Amin bin Muslan, the Director General of the Health Services Division and of the Malaysian Armed Forces. Welcome to the three of you. Indeed, I think we have a very whole of society representation here. We have one medical expert, one humanitarian worker, and one military doctor. So it's very fitting to our topic. So before I give the floor to the speaker, I would just like to do some housekeeping for our participants. So one, I would like to remind you all that there will be a Q&A function at the bottom. So we do intend to keep this session as interactive as possible. So do keep the questions coming. We have actually also received a long list of pre-submitted questions from all of you. Thank you for that, and we'll try our best to answer all of them. Thirdly, I would like to let you know that there will also be people joining us on Facebook Live. So my colleagues will be watching out for any question there, and we're also trying to answer it here. Lastly, we will also be running some polls as we go along this session. So if you see a question pops up on your screen, do take part on the polls. It will run concurrently with the session, so don't get frightened by the sudden pops up. So let us begin. So COVID-19. I think it's fair to say that COVID-19 is a crisis that the world have never seen such a crisis at this scale before. So I just done my last check on the world statistics that is real time. I think we have surpassed 2.5 million cases now. And we have about 178 deaths with about 200 countries affected. In Malaysia, we discovered the first case on January 24th. And by March 9, we have reached our 100th case. And by now, this would be our day 36 of our MCO. So I hope everyone is still hanging in there. But despite all these hardships, I think that statistics are encouraging. We have been recording 2-digit new cases since 17th of April, but it's still too early to tell if we are indeed out of the woods. And as the health DG, Dr. Hisham has said, it is that we should not be complacent about the situation that we are in. So I think apart from these statistics, we Malaysians have also learned for the past few months that this COVID-19 is not merely a public health crisis. Indeed, it is a crisis that involves various segments of the societies to pour in efforts to help. REFSA was actually one of the first few organizations that called for the crisis to be treated as a national security issue. And we also recommended for the National Security Council to take over with the inclusion of the health minister as an interim member and supported by a task force that are made out of healthcare professionals. So we think that this framing is important in terms of shifting our mindset so that we adopt a whole society approach in dealing with this crisis and not leaving it to the Ministry of Health alone. And I do believe that this is a crisis that requires everyone's effort to make it work. So we need every government machineries from hospitals, whether it's hospital and from enforcement agencies, welfare departments, to the private sectors, whether it's food suppliers, logistic companies, or medical equipment manufacturers, and all the way down to the grassroots efforts, the volunteers, the community leaders, and also the innovations that we have from some of the individuals that we have seen in the past few months. So we all play an important part, and we shouldn't stop there as well. So apart from the short-term shocks that we are trying to emerge from, we also need to look deeper on how we can actually build back better, how we can shape our society and economy to be more resilient and to be more prepared in the future. So I think particularly in today's webinar's context, we will also be answering the questions of how we can respond to future crises better. Perhaps we need to be more, to invest more in our healthcare system. Perhaps we need to have a more robust social safety net, a stronger civil military relations, just to name a few examples. And I believe that this is where we can benefit from our speakers today. So without further ado, I would like to invite our first speakers, who needs no introduction. Prof. Adiba Kamarul Zaman is trained as an infection disease physician and is presently the Dean of the Faculty of Medicine of University Malaya, and also an adjunct associate professor at Yale University. Her clinical and research focus has been in HIV prevention and treatment in key populations. She directs the Center of Excellence for AIDS Research, Sharia, at the University of Malaya, and is presently chairman of the Malaysian AIDS Foundation, a trust that raises funds for HIV-related programs in Malaysia. She was a member of the Ministry of Health, the Health Advisory Council of Ministry of Health from 2018 to 2020, and also has been a co-chair of the WHO Strategic and Technical Advisory Committee on HIV, and is currently a member of the UN AIDS Scientific Expert Panel. So very long and illustrious CV. So I will now pass the time to Prof. Adiba, and maybe just to start, Prof, our frontliners, including yourself and your team at the University Malaya, have been working tirelessly to respond to the COVID-19 cases. And in some way, it seems that their efforts have been paid off. The curve seems to have flattened slightly. But as we pour our resources into our healthcare system, there have also been concerns about the capacity of our hospitals. And there's also a report on the shortages of the supplies of the medical equipment such as PPE and masks. So perhaps if you can start by telling us a little bit about the situation on the ground. How are we doing? What is the gravest concern at the moment? And what can we do to make sure that the welfare of our medical personnel are taken care of?
Okay, so perhaps before, and thank you, REFSA, for inviting me to speak this afternoon. Before I answer the specifics of your question in terms of the availability of PPE and so forth to the frontliners, I think it's important to kind of step back and understand a little bit more about COVID infection, why it's different from other diseases and other pandemics, including influenza and the HIV epidemic. I think what makes this virus so different is its highly infectious nature, and not just by the droplet precaution, the droplet transmission, which is essentially what the flu virus is, but because it's also, you know, the transmission can occur through touching of what we call fomite surfaces and so forth, that makes this virus a lot more difficult to contain. And secondly, because of it's relatively mild manifestation in the early stages, the so-called pre-symptomatic stage. And even when someone is symptomatic, 80% of people are not. Quite a lot of people have very mild disease that it kind of moves around silently and leads to infection that it's proving itself to be difficult to contain. So for that reason, it becomes a completely different disease and infection to handle, both at the clinical level and at the public health level. Having said that, over the last 3 months or so, or 4 months since its appearance in Wuhan, I think we starting to understand the natural history of the disease much better, and who is at risk and so forth. So I think it bears a reminder that 80% of people who get this infection by and large will have mild to moderate disease and will recover. It's the other 20% that we need to kind of focus, at least as a clinician, our efforts on. And they're people who are over the age of 60 with high blood, or people who are younger but with high blood pressure and poorly controlled diabetes and obesity. They're the ones who, from big experiences in big centers around the world, and including in Malaysia, they're the ones who run into trouble, either from this new phenomena that we're becoming to understand more and more, which is the cytokine release storm, cytokine release syndrome. So I think by understanding the mode of transmission and the natural history of the disease, I think we inshallah moving forward can manage this pandemic better. For instance, those who are well, infected but well, may perhaps be managed in the community rather than admitting every single person into the hospital. And this is what Singapore is doing, for instance. They're seeing hundreds of cases every day, but luckily many of those are fit, healthy, young foreign workers. So Singapore is managing them in community isolation centers rather than in hospital. Because if something like that happened in Malaysia, we're getting 1,000 cases every day in a small confined area, it will overwhelm our system. So in moving forward, hopefully we won't, hopefully our MCA works, but if we do get big clusters again, then we have, I think we're prepared in terms of having centers to take in well patients, and then reserve the hospitals for these 20% that I said who are at risk of getting complications later on. So I think from a clinical management, we are understanding it better. We can tweak what we do, how we monitor the patients moving forward. Secondly is in terms of also knowing our epidemic. Fortunately, we've not got, and I think credit to the government, credit to Ministry of Health for really taking a proactive move right from the beginning and limiting travel from highly affected areas. That paid off really, really well, right? And what we have now is, unlike say the UK, unlike the US, where they have what I think is a more generalized epidemic, we still have mostly epidemics related to clusters of either the tabligh or international travelers and so forth and so forth. So we have, I think, managed it both from the early part of the response in terms of closing our borders and having very early awareness and testing, to what we've done with the MCO in terms of limiting the level of epidemic in our country. So The question is, now what do we do from here? And taking all those lessons from what we have done in the last 3 months, I think we can improve on what we do further as we, move on from here. As we see the cases coming down, conversations around how do we open, when do we open. We need to learn from what we ourselves have done well in the last 3 to 4 months, as well as what our neighboring countries have done or not done. So perhaps I'll leave it at, okay, specifically back to your question in terms of the PPE. So yes, there were issues, and there's still issues around the availability of PPE to the frontliners. Fortunately, at our hospital, it wasn't such a problem, but we did need to scramble in the early stages to ensure that we had enough supply. To be honest, I think this whole PPE business could have been better coordinated centrally right from the beginning. But, I think there was just, this thing hit us quite unexpectedly, and almost every hospital had to scramble for his or her own self. But I believe thanks to the generosity of the public, donors, and other countries, at least for our hospital, Klang Valley, it is not as good as it should be. So in fact, we cannot relax on this PPE issue, right? I was just discussing with our hospital, as the cases go down, the COVID cases go down, we naturally have to think about opening up the hospital to non-COVID cases. The surgeons are itching to operate. We need to operate in the setting of enhanced protection to healthcare workers moving forward, which means a lot more requirement for PPE than what we're used to. So each hospital will need to determine the requirements both for COVID as well as we open up and operate, like we used to for other non-COVID patients, surgery, etc., etc. So this PPE question is not going to go away even if COVID is under control.
Okay, thank you very much, Prof. I pick up from your remarks that it seems that things are under control. Our MCO has worked to a certain extent, but as we go forward, even if MCO is lifted, there are still a lot of measures that need to be in place to make sure that there's no relapse, and that even that will be there will be safeguards in terms of not further relapse of the spread of the virus. Mm-hmm. So what would you just a follow up? What do you think that we need to do in terms of? I mean, perhaps first of all, how do we know when we are safe to lift the MCO again?
That's a $64 million question, right? And there are many angles to look at. Of course, number one is in terms of the number of cases. Some people have said, don't open up until you get 0 cases for 2 weeks. Some people have said maybe lesser than that. But the question of timing, and then the question of society preparedness. I think the worst thing we can do is to relax the MCO, and the public, and that this includes my colleagues at the hospital, think that life is going to be back to normal. But I'd like to remind everyone that life is not going to be back to normal, particularly people in the healthcare business, because as soon as you relax, from what I said right at the very beginning, this is a highly infectious virus that 98% of the population have no immunity against. And if we go back to having mass gatherings, if we go back to not observing personal hygiene and, you know, lack of social distancing, we're going to go back to square one. So yes, we can think of opening up, but every single individual will need to bear in mind that this virus hasn't gone away, and we'll need to take all those precautions as if it's still around, even if we relax a smidgen.
Yeah, I guess the term that we have been hearing is adapting to the new normal, and I think that's essentially what we are saying, that
Correct.
Things are not going to be the same again, and we are definitely need to adapt to life after MCO. So before I bring in the next speakers, I think we have some questions for you regarding the prospects of having a vaccine of effect, or even like an effective treatment. And I know that your team has also been working on treatments. So,
yeah. So to the question of vaccine, I think there have been a number of recent announcements about, for instance, the Oxford and Imperial groups fast-tracking their vaccine research and development. The Chinese group are also working on vaccines. The Australians are also working on vaccines. The Americans are also no doubt working on vaccines. So this are all very, very welcome news and all very exciting. But the path of vaccines always filled with a roller coaster experience, right? I'm naturally a very optimistic person, but I wouldn't hang my hat on a vaccine so soon. Firstly, even if our colleagues at Oxford and Imperial can fast track vaccine development, it still has to go through enormous steps to ensure safety. The last thing we want to do is fast track and take shortcuts and then produce a vaccine that does more harm than good. And it's for this reason that, you know, there are definite processes in place for any vaccine or any drug for that matter. So you need to go through animal studies, you need to go through, you know, making sure there's no the toxicology studies, the safety studies in animals, in phase 1, meaning in well people, in phase 2, in small group of people, and then the large vaccine trials. So all these take time. So we ain't going to get a vaccine in the next 3 months or even 6 months. I think you've heard, you know, world experts saying 12 months at the earliest, if not 18 months. So I mean, yes, Oxford and Imperial and others may come out with a compound vaccine, but you know that human trial still needs to happen. So I mean, you know, the Sanofi dengue vaccine that held so much promise is a case in point. You know, so I think yeah. So we have to work on the basis that yes, you know, lots of clever people are working on vaccine, but it's not going to be here tomorrow. And so, but at the same token, we cannot all be locked up for the next 18 months waiting for a vaccine. So what do we do, right? So that's what I was saying, that in a way, the understanding around the natural history of the disease and the availability of treatment is now starting to emerge, and perhaps we can modify how we diagnose, how we manage patients who are at low risk, and how we manage patients at high risk a lot better from a public health lens, and therefore together with limiting, you know, together with you know, with a lens on how do we balance this with opening up and you know, letting the economy come back again. I think there are certain ways we can do things so that we all don't have to be locked up for 18 months waiting for a vaccine. So what I mean is, you know, I think we still need to continue with looking for every single person who's infected through diagnosing, contact tracing, isolating, but perhaps we don't have to isolate them in hospital. We can put them in community centers, but keep an eye on those who are at risk of developing severe disease, and monitor them closely. And this is where you know, we need to be creative, using technology, using or working with our colleagues in private, you know, GPs, etc., to make it safe for everyone.
Okay, thank you so much for your thoughts. If I guess if I can try to summarize, is what you're saying is that we are making progress in terms of looking for vaccines, and the Malaysian scientists has also been very much part of this endeavor. And I certainly hope that there will be enough resources given in this aspect. But while we are doing that, we must also have a short to medium term of measures in terms of life after MCOs, and that goes similarly for people, individuals like us, and also for the healthcare professionals. And how do we make sure that we have all the resources in terms of equipments? You have mentioned a little bit about the coordination being the key of making sure that there's enough supplies, and also learning on the job in a way, I guess, like getting better at monitoring, managing the patients, etc. You raised a very interesting point about using technology and also working in the private sectors. Perhaps we can go into that a little bit further, but I would like to now perhaps give the floor to the second speaker, and that would be Miss Lilian Fan. So let me just pull out her CV. Okay, so Lilian Fan is the International Director and co-founder of the Preparedness Foundation, which is a regional humanitarian organization based in KL, Malaysia, and also Aceh, Indonesia. She's also the chair of Asia Pacific Refugee Rights Network, Rohingya's Working Group. She's trained as a cultural anthropologist and has been a humanitarian professional for more than 20 years, working with refugees, internally displaced persons, and communities affected by conflict and disasters, including in Aceh, Myanmar, Haiti, and with Syrian refugees in Jordan. So she currently specializes on the situation of the stateless Rohingya in Rakhine State and in ASEAN, and provides regular expertise to a range of institutions and governments, including the UN, the World Bank, ASEAN, the government of Malaysia, and the government of Indonesia. Between 2005 to 2012, Lilian has served in several large-scale post-crisis recovery missions, including with the UN-led humanitarian response in post-earthquake Haiti. So if we think that MCO has been hard for us, I believe that it is much more harder for a lot of the vulnerable groups and communities out there. And I know for a fact that Lilian have been working very closely with many vulnerable communities in Malaysia, especially with the migrant and the refugee groups. There has been some concerns in terms of as these NGOs go around to help the communities, it might actually have unintended consequences of worsening the virus spread. So I believe that the welfare departments have also put in place some regulations. But I think there are also concerns about how well some of these procedures are in place are well intended. It might slow down the process of getting these aids to the vulnerable groups. So perhaps since you have also have very wide experience in humanitarian actions, perhaps you can share with us what is your observations on the ground at the moment, and also it is based on some of your past experience. Is there any best practices? Are there any best practices that we can adopt in terms of aid coordination? So over to you.
Thank you so much, Ivy. It's a real pleasure to be on this webinar with so many distinguished speakers. Thank you for inviting me to be here. I think that what we're facing now with this particular pandemic, there certainly are lessons that we can learn from previous humanitarian crises and particularly pandemic responses, but I also think there's something quite unprecedented about what we're facing now. And this is why it is so important that the global community, you know, when we're talking about whole of society, but we're really talking about a global whole of society approach, because this is a crisis that is affecting not just one part of the world. We've seen sudden pandemics in the recent past, you know, just a few years ago, and even currently still, there's an Ebola crisis that's going on in parts of the world. But this is really, I think, one of the most recent crises where we're actually really seeing an impact in every continent, every part of the world. So there isn't really any society that isn't affected by this. And that's something that's actually very unprecedented. Besides that, the nature of the way the virus is passed, and the importance of actually having this level of restriction of movement, the type of precautions we need to take place, it changes every aspect of people's lives. And that as well means, it's much more extensive, the types of changes that everybody has to adjust to. And then I think the effect on vulnerable groups, I mean, partly precisely because the movement of all of us has to be so restricted, the fact that jobs are affected, the fact that, you know, the people who are already economically vulnerable or vulnerable in other ways just have actually become more vulnerable, have even less access to services which they already might have had trouble, having access to in the first place. People who are already struggling economically have even more challenges to sustain themselves. They may not have savings, they may not have any type of safety net. So I think one of the interesting things socially, and you know, one of the things that we need to be very worried about as well, is the fact that there are so many inequalities and vulnerabilities that are actually being made visible. And many of them, I think, are from, you know, parts of the society which in many countries actually remain a little bit less visible, and partly, you know, certainly in Malaysia, but I think everywhere in the world actually, because that, you know, we have a lot of crisis that was happening already around the world, and one of the types of crises we were having, that we still do have, in fact, are conflicts and, you know, persecution of certain groups of people. And the fact that those types of crises produce large groups of refugees who flee their own countries to seek protection in other countries, and in many contexts, those refugees don't actually have legal status in the country that ends up hosting them. So in Malaysia, for example, Malaysia has done a lot for refugees, actually. We haven't signed the convention yet, but for many years now, we've already been actually practicing quite good practices. You know, we haven't, it's a little bit imbalanced. You know, some of our practices have been, the good ones have been a bit ad hoc, but we have been actually much more welcoming than many other countries have been. And, you know, the fact that refugees here, although they don't have yet legal status, they still, by and large, have freedom of movement. And they've been able to, you know, come and settle in various parts of the country. You know, it's still tough for them because they're illegal, but the fact is that Malaysia's actually been quite welcoming, and it's not extending, you know, formal assistance to refugees. There is a UNHCR here, there are organizations, but refugees and, you know, many other groups have actually been able to carve out a life for themselves in this country. But the part of the problem now that COVID is exposing is that the fact that they're undocumented is actually a problem, right? Because then when it comes to a pandemic, how do you track people? You know, the fact that you don't have a database now of communities who actually need to be part of the response, which takes everybody into account, right? So now we're looking at, and I think the government has an approach where, you know, we're talking about leaving nobody behind, making sure that everybody is included in the response to the health crisis, but also in the assistance to the hunger crisis and the economic crisis. But part of this problem is we don't actually have the information on everyone. So I think there are a lot of problems that are starting to emerge to the surface during this crisis. There's certainly a lot of vulnerable communities across Malaysia. I think it's also really exposed not just the problems in the refugee community and the undocumented migrant community, but also with locals. I think, you know, the way that we actually categorize poverty is problematic. For many years, you know, we've had, I think, a picture of poverty in this country that has actually not been very accurate to what the actual needs are. The levels of vulnerability in this country are extremely high. There are many people who are just on that threshold where, you know, a crisis like this hits and they actually can't sustain themselves. They don't have savings. They don't have, you know, that safety net they can fall back on. And there are many people actually who are still currently, in spite of everybody's best efforts, who are actually still, you know, being, I wouldn't say left behind, but who haven't received even a basic food basket, to be frank, you know, and that's a challenge. And it's not to say that, you know, it's nobody's fault, because I think at this point, everybody's working really hard. You know, the government's working hard, the NGOs are working hard, everybody's trying. The public has been incredible. The public has been, you know, pouring donations into organizations, including like mine. You know, all the funding that we're getting to do work with refugees and B40 is actually from the public. It's from not from big foundations or anything. It's actually from, you know, individuals who are giving, you know, money to NGOs like ours, who they trust enough to know that we're getting food to the needy people, which I think is amazing, because it shows how much Malaysians care. But I do think that there are some systemic issues, right? You know, there's really a huge vulnerability crisis in this country, which is being exposed precisely because, sorry, I had a call coming in. We need to be careful, because we need to basically understand, you know, that leaving anybody behind is actually just going to, it's actually going to make this crisis a lot more complex, and it could make it a lot worse. So for example, if we do have, for example, people getting hungry, one of the things we're seeing now is a big crisis in paying rent. That's going to be another big crisis. There've already been people who've been evicted from their homes. I just had a group of Rohingya who contacted me last night at about 11 p.m. to tell me that they're sleeping on the street because they were evicted 2 days ago by their landlord. And at a time like this, when we have a pandemic where we're telling people, stay in your home, you know, people should not be fearing getting kicked out of whatever shelter they might have. You know, already I think a lot of these migrants and refugees stay in extremely tiny places where social distancing isn't even possible. But they're getting kicked out of these places onto the street at a time when there's a pandemic, and you know, it's extremely worrying. So I think we need to think about these problems. These are problems that face locals as well. There are certainly locals who are also being threatened with eviction. So I think, you know, we need to really start seeing this issue holistically. You know, it's not just in terms of all the actors and the stakeholders, but how the issues themselves are interrelated. Maybe I'll stop there for now, Ivy.
Thank you very much, Lillian. I think what you're saying, which I find really, really insightful, is that this crisis have affected different people in a various degree, and we have vulnerable groups that can be both locals, and then we have groups that doesn't even have a proper legal status in this country. But the funny thing, that the interesting thing is that what you mentioned just now is how is all going to affect us all the same, and just because it does not affect our community does not mean that this is not our problem, because ultimately the virus is not going to differentiate whether we are a middle class or someone from a better to do family, or we are a poor refugees, for example. So I think we have a question here asking about the screening of foreign workers and the undocumented workers. You've mentioned just now very interestingly the challenge that the government will face in terms of responding in this crisis, just simply for the very fact that there's actually a lot of undocumented workers out there. So in that context, is it actually possible to actually screen some of these undocumented workers? How can we make it? Should we make it mandatory, and how should we go about it? I think you need to unmute yourself. Let's see. Okay.
Okay, sorry. Yeah, so actually, I think one of the most important things the government did quite early on, even as early as late January, was to issue a circular. The Ministry of Health issued a circular, basically to look at, well, to announce basically that all foreigners, regardless of immigration status, who do have symptoms, who are showing symptoms, would have access to free testing and free treatment. And that was one of the most important circulars, I think, to try to take away any barriers for refugees and undocumented migrants and anybody who didn't have proper documentation to come forward. The challenge was getting that information out, so the information on that circular out in the languages that these communities speak. So a lot of work went into translating posters and getting information out, give voice messages in Rohingya, for example, because it's not a written language, and spreading those around the communities, right? You know, some of the embassies, like the Bangladesh embassy, was very helpful. They actually produced their own posters. They were sending out, you know, prevention materials and had their own hotlines and all of that. But, you know, others, for refugees, it's difficult because you don't have an embassy most of the time that's responsible for you. These are, by definition, a refugee is somebody who's fled their own country because they can't be protected by that country and they're seeking protection in another country, or, you know, they're under international protection by right. So it's not possible to expect an embassy to reach out to the refugee population, right? Because they usually don't recognize that population. So it was really down to UNHCR and NGOs. And I think, you know, the Ministry of Health has been working very closely with UNHCR and with NGOs to be able to try to reach out to those populations. So I think that position was very clear from the government for quite a long time already. The problem then became that many of these communities were much more afraid of arrest. They actually thought that if they would present themselves to, you know, even to get a test at a hospital, that they were at risk of getting arrested because they were not documented. And there are communities as well who, you know, we call them asylum-seeking communities, who are from countries where they're being persecuted and are from conflict areas, such as the Rakhine, for example, which is the Buddhist group that's from that same state in Myanmar where the Rohingya are from. You know, this Buddhist community actually are victims now of a civil war, and they're facing a civil war. So, I mean, you know, for many of us, we call them asylum seekers. Most of them do not have UNHCR cards. They can't go back to their country because literally it's a civil war there right now. Many don't have even a basic document here. And, you know, there is a real fear of arrest, precisely because even though Malaysia has been welcoming, you know, many refugees and asylum seekers and undocumented workers, you know, do regularly get arrested. But the government made an announcement that under these circumstances, coming forward would not put you at risk of arrest. The government wasn't going to be interested in arresting anybody, and that the priority at this point really was just about public health. And it was actually our Minister of Defense who came out and clearly said that in a press conference. And literally the same hour that was said, that message was being translated into languages. And basically everybody, you know, in these chat groups in the refugee and migrant communities was circulating that statement to basically encourage others to come forward. So I think there have been efforts to try to encourage coming forward. And, you know, to be honest, I mean, I know now there's this issue of Selayang, and that's very concerning, but to be honest, you know, I mean, even before that, there hasn't actually been that high of an incidence in these communities, in spite of what people think, because I think there's been a lot of misperception and a lot of stigmatization. And, you know, just yesterday, there's this petition going around, which is basically saying to Malaysia, say no to Rohingya, you know, and very, very kind of hateful xenophobic language being used, which I think it really needs to be addressed, not just by NGOs, but by the government, because this is the kind of language that we should not be accepting against anybody. It's not about the fact that it's against the Rohingya, it's against the refugee population. It's just not the right kind of language and acceptable language for us to be tolerating, actually at any time, but, you know, I think especially during a time like this when really our common survival actually depends upon people being able to work together and not stigmatize each other and be cooperative, as we all need to depend on each other to get through this pandemic.
Okay, thank you so much, Lillian. Yeah, I think at this point, I just want to bring out one of the really beautiful comments that I saw here, which says that we are in the same storm, but we are not all in the same boat. And I think that really just encapsulates really well what we are facing here. But yeah, we are only as strong as our weakest link, right? So there is no excuse for us to disregard the fate of this group of people. We are running slightly short of time. I know that there is a lot of questions about refugees. Perhaps we can take that later. If perhaps Lillian can also take a look at the Q&A and if you can answer them separately as well. There's also some very specific questions for Prof. Adiba. So perhaps in the interest of time, some of these can be written in, can be answered in a written form. I do want to say that if you have specific question for a speaker, it would be great if you can just indicate which speakers that you're posing the questions to. So now let's just move on to our last speaker, Lieutenant General Datuk Pahlawan Dr. Muhammad Amin bin Moslan. So for you, sir, thank you so much for coming. I'm sorry that you are the only gentleman here. It's not usually, it's not a very common problem that we see around here to have more female panelists than male panelists. But anyway, just let me introduce you for a moment. So Lieutenant General Dr. Amin is the Director General of the Health Services Division of the Malaysian Armed Forces. During his 33-year career in the Malaysian Armed Forces, he was actively involved in military operations in Gubir, Kedah, and Sungai Siput, Perak. He was very active in humanitarian programs, providing medical services in the remote areas of Malacca, and during the massive floods in Johor in 2007 and in Kelantan in 2014. His involvement in the international humanitarian aid program includes the city of Aceh during the tsunami in 2004 and Yogyakarta during the earthquake in 2006. He also served in the peacekeeping mission under the United Nations in Namibia and attended professional and military training courses abroad, including the International Law of Armed Conflict for Military Medical Officers in Switzerland and the Health Crisis in Large Population course in Australia. So, Dato', the Prime Minister has characterized this as a war effort, but we know that COVID-19 is not a war like any others. Perhaps in a Malaysian context, the involvement of the military in what we call the military operation other than war, MOOTW, is not familiar to the general public in Malaysia. So perhaps you can talk to us a little bit about what is the role of the Malaysian Armed Forces in situations like this pandemic. And I know for a fact that our MAF involvement in this COVID-19 response is actually goes beyond just enforcing the movement control order, which is what most people know about. It also includes things like the medical services that you hate, and there's also a lot of expertise that the military can offer. So perhaps you can tell us a little bit more about that.
Yes, thank you, Ivy. Thank you for the chance to speak and participate in this webinar. And thank you to REFSA, the other panelists. What Prof. Adiba has mentioned and also Lillian Fan has mentioned is very pertinent to how the military is involved in this operation. As the two panelists have mentioned, it's a pandemic or a crisis of unprecedented that we have. The Malaysian Armed Forces have been involved with the nation in many disasters since the inception of independence. And for this crisis, we view it differently. Okay, and as they say, unprecedented situation require unprecedented approach. And thank you, Ivy, for a chance to explain to the public the role of the Malaysian Armed Forces in this COVID-19. But I have a disclaimer that is whatever the discussion that in this webinar does not represent the official policy or reflect the official policy of the Malaysian Armed Forces, but is of my own personal opinion as a military health professional and a practitioner of operational medicine for 30 years. Okay, I have a slide to share. Let's get it. Okay. Okay, let's get over it. That's the disclaimer. Okay, the MAF primary role is actually to protect and defend Malaysia's sovereignty, integrity, and her national interest. That's the primary role, and from external threat. But this is something that many people don't realize, that the Malaysian Armed Forces is also involved in bolstering Malaysia's internal securities and crisis management, such as public order, counterterrorism, and humanitarian assistance and disaster relief. Okay, the Armed Forces is an agency in the government that is of many utilities that the government can use in pursuing its aim. And we call it, like you mentioned, the military operation other than war. Mainly is how the military involved with our civilian counterpart, of which we term it civil-military relation in Malaysian Armed Forces. And civil-military relation has always been the cornerstone in every Malaysian Armed Forces military operation. And we view that civil-military operation as very important and has established concept and fully documented in all Malaysian Armed Forces doctrine and procedures. I think, Ivy, you are very familiar with the Defense White Paper and total defense. And civil military relation support total defense is a key part of the Defense White Paper. And it's actually the linchpin to the success of many military operations. So the MAF civil military relation in this context of COVID is guided by the National Security Council Directive number 20, especially in assisting the civil agency in disaster, in this case, the COVID pandemic, and also the National Security Council number 21, when the government view that the COVID pandemic is beyond your usual disaster, it's become a security crisis in the nation. And the Chief of Defense Force is the member of both committee, which is the National Security Council, chaired by the Prime Minister, and also the National Disaster Management Committee, chaired by the Deputy Prime Minister, of which the two both Security Council Directive is involved. And in civil military relation and civil military operation, the MAF is guided by various guidelines and procedures, both internationally and we in ASEAN are very much familiar with the ASEAN SASOC, or the standby arrangement and standard operating procedure. And of late, the Malaysian Armed Forces is also a member of the ASEAN Center of Military Medicine, which did. So how do we involve in this COVID-19? Actually, we were involved in it much early, circa November and December 2019, where through the health intelligence channel, that we observed death due to respiratory infection in Wuhan hospital through social media. And through that, we start developing. In fact, it is much earlier before WHO dispersed the warning of this death. And we have started information sharing with CPRC, KKM, and the ASEAN Center of Military Medicine in Bangkok circa January. That is before the first case was even diagnosed in country. And the ASEAN Center for Military Medicine actually has a special board meeting for this outbreak somewhere before the first case was detected in Malaysia. And the Malaysian Armed Forces headquarters was involved in the first National Disaster Management Committee for, at that time, was known as Novel Coronavirus 2019. It was chaired by the then Deputy Prime Minister and was attended by the CDF. And that's where we start to view that this threat is actually has the potential to become a major problem for the countries. And since then, planning staff of the Malaysian Armed Forces were involved with briefing and planning with NADMA. And at that time, the time was actually because of imported cases from China. That time, the Malaysian Armed Forces Health Service have deployed a public health specialist as military liaison officer to CPRC at KKM. This was the reason to get a better situational awareness of how the situation is handled in the country. And at the same time, to look at areas whereby the Malaysian Armed Forces Health Service can offer its assistance at that time. But as the situation worsened, as everybody knows, because of the big clusters from the public group, the situation has escalated into a national crisis, and the National Security Council meeting was held. And it's become a more, what you say, aggressive planning that was happening, and until the implementation of the MCO on the 18th of March. And as we all know now, the MCO has gone from phase 1 to just phase 3. So how does the Malaysian Armed Forces involved in this COVID? Is basically for the Malaysian Army, because everybody knows the Malaysian Armed Forces composed of the Malaysian Army, Malaysian Navy, and Royal Malaysian Air Force. The Malaysian Army, as you rightfully mentioned, Ivy, is assisting the Royal Malaysian Police in implementing the MCO, and almost 7,000 troops involved, inclusive of the 6 areas of the enhanced MCO, the latest being in Pasar Borong Selayang in Kuala Lumpur. The Malaysian Army also currently is bolstering the Malaysian land border to prevent illegal entries, and this is to reduce the importation of cases coming from surrounding neighbors. And they also support logistics in terms of food distribution to areas in enhanced and essential requirement, especially in inland of Sarawak. The Royal Malaysian Navy is involved by securing the national maritime borders, from incursion, and everybody knows, it's said that we have to do this. There are illegal landing. These are not the time where Malaysia can afford to have new immigrants coming in, because we are still battling the current situation in country. Naval vessels are also ready to provide sea land communication between Peninsular Malaysia and Sabah and Sarawak if needed. And naval assets are also ready to assist in search and rescue and medevac operation. And not many people realize the Navy Malaysian Army in the MCO in their local areas. The Royal Malaysian Air Force is also conducting air and maritime surveillance, defending the airspace and maritime borders. These are things that we have to do despite the pandemic. We need to protect our borders and airspace. Okay, we don't want people to take advantage of our preoccupation with the pandemics. The RMAF is also providing crucial air transportation, assisting the Ministry of Health in delivering much needed supplies to East Malaysia. We have transported few flight of PPEs, blood, and reagent to assist a hospital in Sabah and Sarawak. The Malaysian Army in some areas of the MCO, and the RMAF is also ready to provide air bridge for quick response to any area in Malaysia, because they have the capabilities of air transportable, have support, aeromedical evacuation, evacuate processing, airspace management, and others. And now come back to my service. Okay, as I mentioned that the Malaysian Armed Forces Health Service have been involved, have been monitoring the development of this pandemic in very close communication with the Ministry of Health in areas whereby we can assist our people at KLIA, and 2 MCO areas where MOH is facing some shortcoming. The MAF laboratory facilities is also assisting in PC Hang, and the 3 main armed forces hospital is also assisting to decant non-COVID patient from MOH hospital when requested. So far, there are already about 100 patients that we received from HKL and Malacca. And currently, our team of specialists, doctors, nurses, involved in running of the COVID-19 run by MOH. But apart from that, the Military Armed Forces Health Service is busily involved in force health protection, because we must remember that the military is also vulnerable to this infection, and it is our priority to ensure that the military personnel are kept protected. And we have developed various activities, developing policies, health education, ensuring that they have adequate PPEs, and providing diagnostic support so that we can diagnose them early, isolation and quarantine when they are threat or suspicious cases, and assist in treatment. And this is what we need to highlight, that despite we assist the Ministry of Health, we also need to protect our own people, because we still have borders that we need to.
I'm sorry, Dato', I think your line is quite bad.
It's a bit unique. You mentioned about warfare. This is how we view that. It is warfare in urban areas, whereby you need to understand the context and culture of that urban society. Throughout this epidemic, we see the real context of Malaysian urban cities. You have people living in condominiums. You have what we call it vagrant on the streets that doesn't have homes, and this really make us, the military, understand what is the context of Malaysian urban society. It's not as easy as you are to go to the jungles, whereby the enemy is on the other side and you are on this side. When in an urban society, you really have to understand the context and the culture of that society, because in a crisis, all those aspects of culture and context of that society is very important for you to mitigate, to solve problems. Thank you, Ivy.
Okay, thank you so much, Dato'. Okay, thank you, Dato'. I think it's interesting to hear that what the military is doing is actually really multifaceted. And while we are responding to the COVID-19 crisis, the military is also still facing a wide range of security threats in our maritime domain and etc. So these are also things that we cannot lose sight. Right, let me now try to get some of these questions answered. There is a lot of questions about the issues about our borders control, and also the incidence of the refugees, and also some of the migrants entry of the migrants from neighboring countries. So perhaps I could get Dato and also Lillian to comment a little bit about that. How are we going to deal with this crisis? And specifically, perhaps for Prof, from a sort of a medical point of view, how do we manage with this situation? There is also questions about what will the new normal in prisons, and also by that extent, the detention places. What would the new normal look like? So perhaps, Dato, you want to go first? Sorry, let me unmute you.
Okay.
Yeah.
Okay. So with regard to the borders, I think everybody have listened to the statement made by the Senior Minister for Defence Cluster, Dr. Sri Ismail Sabri, regarding the need to secure our borders. Okay. So for the Malaysian Armed Forces, this need are being addressed. Yeah. And I think we are looking into areas where of concern, and we are building multiple layers to bolster this border security. And new assets and equipment are being placed, ensure that and we are also looking into developing SOPs at operational levels and to ensure that multiple agency response to such incursion should be met in an effective manner. That is for border control. And with regard to refugees and illegal immigrants, Malaysia, the problem of refugees need to be solved at the source. You see, and we believe that that's why if you realize that Malaysia is assisting Bangladesh in having a field hospital in Cox's Bazar, and ensuring that we have less illegal migrant from Rohingyas to Malaysia. And this also, Malaysia also work with neighboring countries to ensure that joint border patrol will be enhanced, and this will help limit or discourage people from trying to cross borders and complicates our effort to control the epidemic at home. That's it, Ivy.
Thank you. Lillian, do you have anything to weigh in on this matter? Again, I need to unmute you. All right.
Thanks, Ivy. Thanks a lot, Dato Amin, as well. You know, I had the honor of accompanying Dato Amin also on a couple of missions with MINDEF, with a former Deputy Minister of Defense, as well as a former Foreign Minister, and seeing, you know, what Malaysia is doing for the Malaysian Field Hospital in Bangladesh, in Cox's Bazar. I think it is really important that we've invested in trying to support Bangladesh with their response to refugees. I do also think that ultimately the problem is inside Myanmar. It's not even with Bangladesh. The problem is really the fact that there's this ongoing discrimination and ongoing statelessness problem against this minority, against the Rohingya, and there's really no solution in sight for it. That's all been made even more complicated because now we actually have a civil war in Rakhine State against the local indigenous population there, the Buddhist Rakhine, which means that actually it's going to be impossible to think about return in a sustainable way anytime very soon. That's on top of, you know, all those complications. We're now looking at the pandemic, right? So I think we need to be very realistic when we think about what the options are for the countries in the region, but also what the options are for the Rohingya. You know, if you imagine that you were born in a camp, or you were born in Rakhine State and you had to cross and, you know, flee to survive to a place like Bangladesh and basically live in a camp for many, many years, the options are extremely limited. So I think that we can't blame the refugees themselves. I think we need to stop this rhetoric about say no to the Rohingya, being basically blaming people who are victims of conflict and crisis and persecution and genocide even. We have to stop blaming them, right? We need to start really holding accountable the people the stakeholders who should be accountable. Who is to blame for this violence and this discrimination against them? And I think practically, it's right, what Dr. Amin says. I mean, we can't expect all countries to open up the borders to every single group of refugees who's fleeing. But I have to say, Malaysia has actually, we've done that before, and we have taken in a lot of refugees, even without signing the convention. The fact is that now, of course, we're in the time of a pandemic. So I think that we do need a humanitarian, not just a humanitarian solution, we need a solution that is humane, but is also thinking about our own protection as well. So where do you strike that balance? I think it's not an easy answer. There are groups who are saying we should just take all refugees in. I don't think that's necessarily the answer, because the point is, this is a very complex situation, and there's a business as well of transporting refugees. There is smuggling and trafficking that's going on, and I think we can't forget that. I think if we do just encourage more boats to come, it encourages that business to grow again. The countries in the region have been working really hard to make sure that that business doesn't thrive, and we actually succeeded for a few years. From 2015, for the last few years, we've seen fewer boats. But at the same time, now, this year there was actually a rise in the number of boats that have been coming, because the smugglers and traffickers feel that they can get away with it again. I think they were very unprepared for COVID. They didn't realize that countries would be shutting their borders down quite so tightly. And it's really unfortunate, because now it basically results in 3 or 4 boats in distress. One has returned to Bangladesh and has landed. 2 of them actually arrived close to Bangladesh yesterday, and I think are in the process of being disembarked. And there could be a few still out there. Boats in distress with a lot of very hungry, sick people, and many who have died at sea. That's the reality. And so, I wouldn't be the person to say, Malaysia should take everybody in unconditionally. I don't think that's fair. I don't think any country in the region is equipped to do that and should do that. But I think we do need, as ASEAN, and actually in the region, we need a kind of a protocol, and Dr. Amin was talking about the way that the region needs to have, and we already have SOPs for certain types of crisis, certain types of, disasters. When it comes to something like looking at boats in distress that are basically where the passengers are undocumented, stateless persons, irregular migrants, we've started to talk about it in things like the Bali process, but we don't really have a proper, mandatory kind of SOP, which allows for an immediate response as well. And these decisions which are delayed, it ends up, there are human lives at risk here, right? So there really isn't a simple answer to this. But I do think we really need to keep talking about it. We shouldn't be, we shouldn't shy away from having open discussions about what's feasible and trying to balance, the humanitarian concerns. And I think at the end of the day, really being able to be a lot tougher on the country that is actually responsible for these problems in the first place.
Okay, thank you very much, Lilian. Prof, perhaps a very short interjection from your side about the questions of new normal in terms of prisons. Sorry. Can you, I can't seems to unmute you.
Mute myself.
All right,
Okay, I'll start again.
So
the issue with prison is not dissimilar to what we've heard from Lilian and Dr. Amin around Rohingya. Even before the COVID pandemic, the mantra for prisons is prison health is public health. And we really need to incorporate this whole of society response to COVID to include the prisons. And this is because prisons are the perfect incubator for an outbreak of COVID. And this is something that's been worrying me and my colleagues, having worked, or our work while working closely with Kajang Prison in particular. So, you know, what is the answer to it? Well, number one is, of course, to reduce the number of people in prison. There are some countries there, and that number of countries is increasing, are actively discharging, that's a hospital term, I'm not discharging patients or in terms of prisons, you know, letting prisoners out a lot earlier, particularly those with minor offenses. And I think this is something that perhaps we in Malaysia also need to look at. Already, even before the COVID pandemic, we've been advocating for decriminalization of personal drug use, and perhaps it's time to relook at that. And then, of course, you know, basic hygiene, et cetera, for those remaining in prison should be paramount. It's hard to do, I know, but I think it behooves us all to realize that the health of prisoners is the health of society, especially in a pandemic like this.
Thank you very much, Prof. I think we have about 10 minutes left, and I really want to bring us back to some of the key themes of our webinar today. So one of it is adapting to the new normal. So I think that this is really on everyone's mind. How do we move forward as a society? And also, when it comes to how a society respond, how do we actually harness some of the initiatives and energy that we have been seeing, some of the goodwills that we've seen from Malaysians. I think Lilian mentioned a really good point about how do we, on one hand, we see a lot of very encouraging signs about Malaysians really coming together. But on the other, we also have to look deeper into the future of building, to address some of the more systemic issue, and also to build better in terms of resilience. So perhaps I can just get some of your thoughts about how do we go forward in a more medium term, adapting to the new normal, but also in an even longer term, how do we build resilience into our society? And perhaps we can start with Professor, since you have the floor now.
Yeah, I think I first of all want to acknowledge, you know, the amazing response from the public that we have personally experienced, and I've personally experienced. For instance, in my call for funding for the tocilizumab study, individuals and corporations came forward very quickly that we managed to raise the desired fund in a relatively short time. So no doubt, you know, there are many generous Malaysians and corporations out there, and you know who you are, and I thank you for that. So how do we harness all this? And I think what I think the COVID pandemic has shown is that a strong public health system is essential, right? What Ministry of Health, a public health entity, has done is amazing, has been acknowledged all around the world, but you know, there's obviously room for improvement, as there is for any health system, and I think moving forward, ensuring that that public health system is strengthened, improved, and when I say public health, that also includes my universities, our universities, you know, public health university hospitals, needs to be, you know, when all this is done and dusted, we need to take a big look at all of this, you know. We're constantly under threat in terms of medical education, funding to medical education, etc., etc. So, you know, placing huge importance of on public health versus health as an economic gain vis-a-vis, you know, health tourism, private health system, and insurance, and all that. Are questions that really need to be answered in more depth moving forward. and how does the public and private, how do the public and private health systems work much better in situations like this? I mean, to be fair, the private health system were ready to accept patients if we had to decant, if we had to move non-COVID patients, etc. But it could be better than that, I think. I'll leave it at that because, you know, there's too much details to go into.
Thank you, Prof. So now I'd like to ask Dato' Amin for your views, but before that, there is a specific question for you on public education and information, and attendee is suggesting that armed forces should play a bigger role in terms of spreading information and public education. So what's your thoughts on that? And there is also another question about the coordinations between government agencies. How do we ensure that there is a smooth transitions from MCO to post-MCO, and whether or not the health minister is actually part of the MKN, the National Security Council. So I'll give you the floor. Okay.
Okay, thank you for the question, Ivy. First and foremost is basically public education. So the Malaysian Armed Forces, through what we call our media operation, we also help to spread the news on stay home. I never like to use this word social distancing. I would prefer the word safe distancing because social distancing is very difficult to understand what is social distancing. But safe distancing is very clear. It should be more than 1 meter. As long as you keep yourself more than 1 meter, you're quite safe. Yeah, and through our media operation, we are trying to help and also assist in spreading this word. And from the human aspect, all our personnel, when they go down on the field, especially at this point, they also advocate people to wear masks, people to wash their hand sanitizer, and also to keep safe distancing. And this is basically part of how the military work. They're not only enforcing, but they also work with the public to ensure that they abide by this call to encourage the stop of transmission. On the aspect of how do you manage the multi-agencies in effort post-MCO. At present, we have a lot of military planners at the National Security Council assisting in scenarios, how it would work post this one. And as Prof. Adib has mentioned much earlier, this is something new. We still have about more than 90% people unimmune to this infection. And how would be the new norm would be, and how compliant are the public once the MCO is lifted? Have we get it into our culture? Abiding by this simple rule of wearing masks or keeping our hands clean and keeping safe distance and not to overcrowd. So these are challenges that we feel. And mind you, it's not just about health. It's also about restarting back the economy. And I've mentioned that understanding our social culture and our urban society context is very important. What is the economy in the urban society nowadays? How many people actually wage earner? How many people actually day earner? This is very important because as Lillian has mentioned, we are noticing this is going to be a new challenge and post-MCO for us. Okay, and yes, the Minister of Health and also the DG in this current COVID-19 outbreak is a member, technical member inside the National Security Council, advising the government on how giving technical inputs on especially on how to approach the management of this crisis. Okay, Ivy.
Okay, thank you, sir. Lillian, if you have any thoughts.
Yes, I was thinking actually that, you know,
Oops. I think we lost you.
on the one hand, it's helpful in some ways to make sure that people understand that, you know, things are a little bit different now. Then things certainly have changed. The landscape is different. You know, you know, a lot of daily practice is going to be different. But I think we need to actually get away from some of that jargon and start breaking down and doing proper analysis. And I think that's where, you know, the roles like think tanks like REFSA come in. You know, having discussions, really, you know, important discussions about every aspect of the implications of what this new landscape looks like for us, right? What are the new risks? How do we deal with the economic vulnerability? How do we deal with the social stigma? You know, there's so many topics that are going to emerge from this experience that we really do need to be discussing together as a society. And I think if we're bringing more and more groups together across sectors, across class, across, you know, documented and undocumented, all these different divides, right? I mean, this is exactly our opportunity to try to come together as much as we can across as many divides as we can, and try to find a way to address issues in a very, you know, in a more comprehensive way. And we have an opportunity to do that, but I do think that there are still some groups where it will, you know, who will still always be at risk of being somehow excluded, and we need to be very vigilant about continuing to reach out to those groups. We shouldn't assume that we know who they are, actually, because it's not as simple as, you know, all refugees are excluded and all non-refugees aren't. It's not that simple at all. You know, there are some refugees who are very well connected digitally, who have smartphones, who speak the languages that are used in this country. There are some refugees who are illiterate and have no smartphones and are living in remote areas. But there are also some, you know, there are many locals, there are many Malaysians in that situation as well. So I think we need to start having different types of criteria to look at who's vulnerable and who isn't. And you know, I really do think one of the biggest issues for many of us working with refugees is this issue of documentation. And again, that's something that faces many Malaysians. There are many stateless Malaysians who don't have even basic civil documentation. They don't have an IC. There's an enormous stateless population in Sabah, which really needs to be dealt with. You know, if we don't have documentation on anyone who's in our country, when it comes to a crisis situation, we don't know how to reach people, and we don't know how to protect not only them, but we don't know how to protect all of us, right? So I think, you know, these are the types of issues which I think we really need to start to address very centrally in our thinking, in our policy thinking.
Okay, thank you very much, Lillian. I think this is now 3:35, so I think unfortunately that's all the time we have. So I want to thank all of you. So I want to thank all the speakers, and we have just put up a poll for you to take part. So the question is, what is the first thing that you will do once the MCO is lifted? So I think it's a multiple choice, so vote away. And so while we are doing the poll, just want to bring in the speakers once again to see if you have any last words. Perhaps the question would be, what is the one biggest lesson learned for us, or anything that you think that the points that you want to re-emphasize? So I will start again with Prof. Adiba. And I also think that we don't really have time to talk about the technology thing. So perhaps if you can just elaborate a bit, because that's a really, really interesting aspect as well.
What are the lessons learned? I think two things. At a personal level, something like this really makes you think what's important and what's not important in life, right? But on a professional level, I think the only way we can overcome this is by everyone working together, both at the hospital level, at the society level, at the government agency levels, because, you know, in any crisis situation, there needs to be a concerted effort, and no one would know better than that than Dato' Amin. But I think unity in diversity and working together will be the only way, not just to overcome these crises, but moving forward as a nation.
All right, thank you. Lilian?
I mean, so for me, I think, you know, a lot of the issues that many of us have mentioned before, you know, working together. But I think for me, one of the most, maybe not lessons, but one of the most memorable things certainly from this period so far is, you know, how much I've seen people really come together at the grassroots level, and how many, you know, not just Malaysians, I mean, you know, the refugees we work with as well are out there supporting others, you know, even like my entire team of you know, volunteers who are helping us pack, and of course our team, our professional team as well, are all refugees except for myself, you know, and they're refugees from Syria, from Afghanistan, you know, Myanmar, Rohingya, and Yemen, and the entire team, including some young Rohingya youth who have just joined us, you know, just actually released from detention, are actually the ones packing, you know, the food baskets for every person we're sending to, whether they're Orang Asli, whether they're a Buddhist, you know, Rakhine Myanmar refugee, whether they are a local, you know, B40 family. It's, you know, Rohingya refugees who are actually helping us do this packing. And for me, I think it's an opportunity for us to break down the barriers at a very, you know, at a policy level, but I think at the everyday level as well. And I think for me, that's one of the most meaningful things about what's happening now, that, you know, we should be using this as an opportunity to build understanding, to build compassion, to build solidarity. And even as we are keeping safe distances from each other, we need to be able to know how to reach out to each other in different ways. So that would be the biggest lesson for me.
Thank you. And last but not least, Dato'.
Yes, Ivy. I think I will reiterate what Dr. Hisham has mentioned, the virus or the viral. I think this pandemic is a little different. We have seen Nipah before in the 90s, SARS, MERS-CoV, and avian flu in the 2000s. There were not much social media then, but for this epidemic, there's a lot of social media. On the good side, more people get concerned about this outbreak. On the bad side is basically a lot of fake news. And that also sometimes make us to shape perspective, quite difficult to shape perspective, because people have developed perception based on fake news. And it also creates a lot of distrust. And what we learn is basically from this epidemic is how do we manage perception and ensure that the correct message get passed on to the public, so that they can respond correctly and be safe at the same time. Especially, like Prof. Adib mentioned, we are dealing with a very, very infectious virus, which easily transmit. If you don't keep yourself safe, you might yourself succumb to it. That's it, Abby.
Thank you so much, sir. So our poll result is out. It looks like it's quite a tough, quite a close fight. But the winner is visit your family. Yeah, like, I guess we are Malaysians, we are still Asians. Family is still the most important to us, right? So thank you so much for all the speakers today for taking time out your busy schedule. And I want to thank you once again for all the great work that you're doing at the front line, for the doctors, for the military, and also the humanitarian workers. Thank you to all of you as well for joining us today. I'm really sorry that we cannot answer all the questions one by one. I think what we can do is, if you still have burning questions, please email it to REFSA's email. It's info@refsa.org, and we will channel the questions that you have to the speakers so that they can get back to you separately. So with that, I want to thank you everyone once again, and I wish you a good rest of the evening, and do join us for the next webinar. Thank you.